Hey friends, I'm Maxwell Freud, a queer Minneapolis-based game designer and the host of Hatch This Way, a limited audio series where I chat with other queer folks in the tabletop industry to learn all about who they are and how they contribute to the hobby by being their authentic selves. And today I'm joined, once again, by my friend, Nersi Nikakhtar. Nersi, how are you doing?
I'm great. How are you?
Good. And
welcome back.
Welcome back. Here we are again.
Yes.
So we had talked before, and if people want context, they can go listen to the other episode where we talk about you being a sometimes doctor and growing up gay and Persian and the struggles of toxic gay men.
Yeah, that was one of your earliest episodes that I have to scroll way down to get to it, probably.
Yeah. But worth it.
Yeah, totally. How are you not worth it? How are you not worth every episode, Maxwell?
Definitely not worth it.
Come on.
So what happened is we were talking about stuff, and then we had done an episode where I talked to one of my guests who is Salmation, and you were listening to our conversation, and you had thoughts as a medical professional on the terms we were using and things we were saying, and you mentioned your like very specific interest in sex, in gender, in people, and how people have very misinformed opinions about sex and gender. And so I just wanted to have a little review episode with the doctor side of Nersi, where you get to drop all of your professional knowledge and give us the real deal, the professional medical expertise on sex and gender, and set the record straight for people on why it's different, how it's different, what people are getting wrong, what people don't understand. Where should we start with that?
Oh, gosh. Well, I should probably provide some bit of disclaimer that I am not specifically a physician who is focused on sexual health medicine per se, but a portion of my work involves thinking and advising medical providers, thinking about and advising medical providers on providing and specifically gender affirming care. And so we do spend a lot of time thinking about things like sex in the sort of biological label kind of way, not the other kind of sex. I mean, also that too, I guess, because they're related often, but not always. And gender and gender identity and gender expression and how we get there and how people who are medical providers can help explore and understand and reflect and support that, especially because for a lot of people, access to things that will help affirm and or realize their identities are kept under lock and key by medicine, in part because of things like prescriptions, or you actually need a surgeon to do surgery. But a bunch of other parts of it are also particularly held close by the medical world. So I'll say that I spend a lot of time thinking about it, but I did not do my residency in sex and gender.
Right.
Because there isn't one yet.
And I assume that just being in the queer community has given you like a lens and a higher level of empathy than probably most cishet doctors might.
Probably. I mean, right when you have an identity that constantly requires how you think about how you fit in a world when a lot of times people don't have to do it because they just do. They automatically fit. It does, I think, make it less of a leap sometimes to then think about how other people deal with that as well. Other bits of caveats. So I am an internist. My specialty is internal medicine, which is adult. The way I describe it is it's adult non-surgical medicine. And two pieces of that are important in this discussion. One is that it's adult. So, for example, I don't specifically work with children and adolescents. And exploring gender and gender identity and so forth in children and adolescents is very complicated and is something that we sometimes talk about, but is not something I practice. And then I'm also not a surgeon. So depending on where you'd like this conversation to go, I am not someone who actually does anything specifically surgical. And so my knowledge will be limited to that.
Yeah, I think where I'd like to start, and I think where I want to get a lot of information, is giving people language on terms that are commonly used, just to have more informed conversations about it with people. So I don't know if you want to start super basic. What's something we need to understand when we're talking about sex or gender? Like, what do those terms mean?
And that's a reasonable place to start. Oftentimes I do training for medical providers, from students through practicing folks, practitioners. And usually we start with some basic definitions, which can seem a little basic to a lot of people, especially, I don't know, depending on your audience, but I'm just going to do it anyway. And one of the important distinctions that we start with is the difference between sex and gender, because the two are often conflated in people's minds and they're very different. And this is going to seem like obvious to a lot of people, but we want to bring everyone up to the same page. So sex is a biologic classification. It is very often in humans thought of as existing in a male-female primary dichotomy, though that is for multiple reasons not exactly true. But it is, there's actually it's a definition that's weirdly hard to get around. You can just say, oh, someone male or female. And one of the questions that can come up is, well, how do you decide that? Does that have to do with your genetics? Do you have an XX or an XY chromosome? Does it have to do with the kinds of hormones you produce in your body pre-puberty, even as a developing infant? Is it the hormones that you're exposed to in utero, which can change that? Does it have to do with what sorts of reproductive organs, so external genitalia, internal genitalia, gonads being testes and ovaries? Which ones of those do you have? Which ones do you have before puberty? How does that change with puberty? What hormones do you get with puberty? And so it's complicated, even though you'd sort of think, okay, generally, if I say that someone is male or someone is female, I think I can answer most of those questions, but you really cannot. So, for example, there are certain folks who have XY genetics, but externally present very much as female. Is that how would you classify their sex? So I'm not going to get into the complexities of that, because people will turn this off. But basically, that's what sex is. It's sort of the biological ideas of how the categories we define. We can come back to that. There are which is probably going to get to some of the points you talk about, is concepts of, for example, having multiple sexes or being intersex, and what does that mean, and so forth. Gender is a societal construct. A lot of human societies have a concept of gender that includes man and woman, which they try to correspond with the male and female sexes, but there can be multiple genders on top of that. And so gender is basically categories to which people can be assigned within a particular society, and how you get assigned has a lot to do with things like how you speak, how you dress, what roles you have in society, and also in part how your body looks, which is oftentimes where it's very closely linked with sex. So gender itself is a broad category that varies by society, but has a societal creation. So the very simplest way to say it is sex would be things like male, female, etc., and gender would be things like man, woman, etc., because it means something different to be a woman than it does to be a female in our society. And that probably conjures up a lot of varying images when you hear those terms. Then there's a gender identity. And gender identity is how one views their own gender, which may or may not fit into the particular categories imposed by the society in which they're living. So, for example, if I use myself as an example, I would consider my sex to be male, my gender to be a man, and my gender identity is also that of a man. So that would, for example, make me a cisgendered man. I consider my gender to sort of align with everything external that was placed upon me. But someone who is, for example, transgender, and this is where things get murky because that also implies that there's a gender binary, and that can get a little bit tricky if you think about it, has a gender identity that does not conform to everything else that would otherwise be externally imposed. And then you can also have terms like gender nonconforming. For example, someone whose gender and gender identity and some other terms I'll get to don't conform to the particular categories that are traditionally put out by the society. And then there are people who are, for example, people who are identified as non-binary, and they don't have a gender and gender identity that exists in that like man-woman dichotomy, which really doesn't fully exists. So that's gender identity, sort of what gender do you ascribe to yourself? And then there's gender expression. And gender expression is how you present your gender to the world at large. And that can be tricky as well. All of these things can, especially the gender identity and the gender expression, can change over time. So in a simple way, for example, let's say that you are someone who identifies as a transgender woman. Your gender expression might change. You don't feel safe at work, so you don't have an expression that is particularly feminine at work, but you do with your friends and so forth. Or it might change as your sense of gender changes with time, and you might have identified as being a transgender woman, but now you thinking more about yourself or realizing more about yourself, identify as non-binary and so forth. So the important thing to know about gender expression is that it does not have to be consistent, and it does not have to be static. It can change. Yeah, so those are sort of the biggies. And what's really also important is that these are not specifically related to anything that has to do with attraction, sexual attraction, romantic attraction. So I don't know how much of that you want to go into. That's probably less medical per se, but none of these things specifically determine the kinds of people to whom you have an attraction. And a lot of the terms that we have traditionally had for attraction have also implied that there's a gender binary. And, for example, what is the difference between being bisexual and pansexual? Bisexual, for example, implies that there are two genders or gender expressions or whatever, and you are attracted to both of them. But pansexual, for example, can be used by a lot of people to say, I recognize that there are more types of genders than just two, and my attraction is not limited to just those two, and so forth. So those are the typical terms we use. And then there are a lot of terms that I don't know if we necessarily need to go into that have been typically used in the medical spheres that are stigmatizing and pathologizing. And so we try to discourage those. And the other really important thing is that these terms are evolving, and as there are thankfully more open discussions about things like sex and gender and attraction and so forth, they're evolving very quickly. And so, I don't know, in a few years, you might listen to this and be like, what is he talking about? Those are such outdated terms. And it's important to just recognize that the terms you learn now may not be the terms that people will be commonly using in a few years.
And is that something that was new, like recent, those terms and the way of thinking, or was that taught to you when you were in school getting your medical license?
No and no. I think those are separate. I think these terms have hit a sort of general consciousness more in the last several years than they did, say, 20 years ago. Not always for great reasons, right? And so there are oftentimes for various political reasons that people who are marginalized are being used for political gain, and that creates a discourse around them and gets people sort of familiar with the term sometimes poorly. But I think on the plus side, there's actually just also a ton of people who are talking about it in a positive way and about themselves and coming out about it. And I think there's much, much more representation, not only people themselves, but I think just it's a thing that you're seeing integrated a little bit into broader society, media, and so forth. That said, generally speaking, there is not very much education around any of this stuff in traditional medical training. Certainly not when I did it, which was 20-some years ago. There's some now, and I certainly know this because I am one of those bits of training at a medical school. It's generally not much in a lot of schools and generally inadequate. I think what is important is for people to have some general understanding and at least sort of current ways of thinking and terminology around it so that it does not seem as mystifying or foreign when it actually becomes part of their care. So they actually know how to be open and inclusive in their language and their practices without having to target which people they have to be inclusive with and so forth. And so that when, they are taking care of folks who have these identities, whether or not it's actually the specific target of the kind of care they're providing, they can at least be thoughtful about it. And so, it is not, for example, important for me to have everybody know how gender-affirming surgeries are done. I think knowing that they exist and knowing how to properly talk to a patient for the first time and introduce yourself and introduce pronouns for you and for them and what, the names you use and so forth. Like, that is happening a little bit more, but honestly, I think if we can get that as part of the mainstream medical world, I think that would actually open the door to a lot more conversations, which could, I think, get people farther. But sadly, it is still pretty uncommon.
Mm-hmm. Yeah, I went to school in middle of nowhere, Wisconsin, and I don't know if this is normal or common, but my biology teacher, when we were learning about human bodies and XY chromosomes, he made a point to point out that there are people, like you said, with XY chromosomes that present female. Their bodies don't always match what genetics say they should present as. Mm-hmm. Like, there are all these exceptions to what we would think of as the rule, I guess. Yeah. So, I mean, I don't know how many of my classmates absorbed that or applied it.
Were you all over it?
I don't know. I think I was fascinated. It's kind of an interesting thing, to hear that and think, well, okay, it's one person, one in how many, but still, I think it is uncommon, but it's not unheard of. I don't think it's that rare.
The rarity being the person who has the XY, the androgen insensitivity, that, or do you mean they're having a health teacher who described it? That's the rare thing. Because I feel like that's the rare thing.
Both. Because I think the way it was presented, it seemed like, there's maybe 5 people in the world who have this. Oh. And, I think that's how some people could interpret that and be like, well, they're just weird. That's a weird thing. That's not how it normally is. I think the reality is it's much more common than that.
I mean, this is probably tough to ask of your recollection of middle school Maxwell, but did you have a sense of the intent behind the presentation?
Well, I think the intent is he was just teaching us the terms and ideas and concepts behind chromosomes and sex and gender.
Sure.
He was very well intended. He was a very good educator, I think, in hindsight, and being open and helpful, answering questions, and open-minded for teaching in a small town where teachers had definitely been let go for less.
I also wouldn't be surprised if that stuck in your memory, as when you were a queer kid growing up and you're just looking for even the smallest signal of affirmation in something someone says or something you see on TV and so forth. And that sort of carries a lot of weight where, I can imagine a lot of your classmates just shrugged it off and kept on moving, which is also part of why I think it's really important that we be thoughtful about how we present ourselves and our language around things like gender to people, because oftentimes you're stuck in a situation that's unfamiliar to you and you're just looking for some signal so you can make that decision, like how safe can I be? And so hearing that kind of little opening, I think, can go a longer way than a lot of people realize.
Yeah, for sure. So I think going off that conversation an idea. Talk to me a little bit about the definitions around intersex or, other interesting edge cases that aren't just the I'm XY, therefore I present this way.
Oh, yeah. I don't really want to call it an edge case, but sure. Let's go back to the concept of sex as being a binary. So when, and this is going to sound horribly medical, I apologize in advance, but when the embryo is developing, certain tissues within the embryo will go on to form the gonads and the internal and external genitalia. And basically, the way it works, and this is an oversimplification, but if the developing embryo gets exposed to androgens, it starts to develop things that look more male, right? Holes close up, the gonads come down and form the testicles, and then you get the phallus that turns into a penis and so forth. And if you don't get exposed to androgens, then it takes on the appearance that we typically have associated with females. So, for example, you have a vaginal opening and the ovaries stay up in the abdomen, and so on. You get the phallus becomes a clitoris and so forth. And so the tricky thing is that it's not going to do one or the other. And occasionally you will have someone who develops where the development isn't very clearly in that male bucket or the female bucket. And the traditional term for that has been intersex. There is also a term that you might see used as DSD, which is disorders of sexual differentiation, which sounds medical and kind of awful because it's got the word disorder in there.
Yeah.
But the way I try to conceptualize it is if you're thinking, and this is again very much fixed on the model that your sex is based off of your external appearance. But if you think about your sex as being related, for example, to your anatomics, there's a spectrum, and you've got these sort of anatomically classical male on one end and female on the other, and people can sometimes fall in the middle along that. You don't need, it's not like Plinko where you fall into this bucket or that bucket. And so that's I think the way to think of it. But when we think of sex, we do tend to rely on a lot of external appearances, right? So for example, when someone who is pregnant is having an ultrasound and they are, quote, trying to determine the gender of the child, which I'll get to my issue with that in a minute. Really, it is a, do I see a penis on the ultrasound or not thing. So it isn't you are having a boy or you are having a girl. It is, I can tell that your developing fetus has a penis, or nope, do not see penis, is really what it comes down to. Mm-hmm. And that's, I don't really dislike the term gender for that, because like we talked about, gender is something that has to do with your place in society and eventually your gender identity. And so that has nothing specifically to do, it's not nothing, but it's not related necessarily to whether or not you have a penis, which is also why I hate the term gender reveal parties. And so whenever someone says we're having a gender reveal party, I say, nope, you're just having a party about whether or not you saw a penis, which is, as things go, an interesting reason to have a party.
Yeah, I don't know that I've actually talked about gender reveal parties on an episode yet.
Well, you have now.
I mean, yeah, I don't know. I've had friends, coworkers have kids, and I understand it gets very exciting to know whether or not they have a penis and make all these like future plans for that child based on that information. Like you make paint colors and decorations, and I don't know, you're basically planning out their entire future and grandchildren and where they're going to live. Like I feel like you just immediately just get so excited and you're like, oh, this is who they're going to be based on this little piece of information.
Yes.
It's so much pressure.
Also, especially like you're not going to actually know their gender for a very, very long time. They're not going to necessarily know their gender for a long time, and it may change. Who knows? And so the idea that you can, and that's the problem we run into, right, is that we assign people gender based off of these ideas like what you observe on an ultrasound, which is why it's really important to think about concepts of gender and gender identity as being very, very different from one another and from sex. And one of the difficulties with people who, may identify as intersex or have DSDs or another term that you'll sometimes hear uses ambiguous genitalia and so forth, is the sort of pressure that there is to just hurry up and assign a sex to this kid because it'll just be awful if they don't have one, even if everything is functioning fine. Now, there can be some problems in terms of like the plumbing aspects of it, which I can appreciate a bit more about why you'd want to do anything surgical about it. But if everything's working okay, just this idea that I need to have an answer for when my aunt comes over and I need to explain whether this is a boy or a girl. And what had for many years been done is that oftentimes the children underwent so-called corrective surgery and were given female genitalia. And the rationale for that a lot of the times was oftentimes it's based on someone, surgeon and or the parents, whatever, of the child making some kind of decision. Oftentimes it's just based on what was surgically easier, right? It's just easier to make a vagina.
Like on a newborn?
Mm-hmm. Yeah. Oftentimes done very, very quickly. And there's this, and I say historically like it doesn't still happen, and it does, where parents had sort of even been left out of the loop for their children and just kind of said, oh, hey, there's some surgical stuff we need to take care of. Informed consent would require that you do that a little bit better. But yeah, people would then just kind of have their child sort of whisked off and really not know the full extent of what was necessarily going on because it was viewed as abnormal. And this movement came about of, why don't you leave these children alone? And then if as they age, they get a better sense of how they identify their gender identity, then maybe you can, if everyone feels like it's in the best interest, including hopefully the child, if they're able to make the decision to do something surgically to try to align with the sex that they want to align with their gender identity, fine. But that obviously it takes a while, years to happen. And so sometimes people are not comfortable waiting. And what was really interesting is that there was a surgeon in the, maybe a couple hundred years ago, maybe not that long, who actually is a urologist and actually had a series of children who he followed who had genitalia that sort of fell somewhere in the middle. And, there wasn't really great surgical technique for this. And so he just followed them and saw how they did, and they did okay. But what I think was really interesting about it is that the better the surgical technology became, the more pressure there was to do something about it because you could now. And so it was one of those interesting things where the advancement of medicine actually sort of made things worse by saying, well, we can do something about this now, so let's just do it. So that is intersex, and that's a little bit different to, I think, maybe some of the other things you also want to talk about. So what else do you want to talk about?
No, that's all fascinating. And I feel like I've heard stories, and maybe they're more fictional, about, getting to a point where you choose, I think very Gattaca of, oh, here's the gender I want. Here's how I want them to look. Here's what you can almost genetically
gene editing
edit your child.
Yeah. I mean, that is one of the concerns that has been brought up with CRISPR technology.
That's a thing.
It is. There has been, I feel like there hasn't been a whole lot of talk about it very recently, but a few years ago, there's a lot of talk about doing gene editing in embryos that have some significant genetic mutations. So, for example, severe disease and so forth. Can you go in and edit that out so that the child does not have that? And where do the ethics of gene editing, gene optimizing offspring come from?
Yeah, where do you draw the line?
Yeah, which is, again, sometimes the better we can get in technology, the more intolerant we become.
Yeah, It's like,
which is obviously different if you're like thinking about this as a very painful or fatal mutation versus I would like my child to just look like this or have this particular trait or not have this particular trait, which you can live with. But, that line gets a little bit murky.
it is just an interesting, though, like having the terms of sex, like biological versus gender identity and expression. It does, from what I'm, it doesn't matter how much you edit it, you can't control that necessarily. Like you can influence it quite a bit, it sounds like, based on society and how they present, but it doesn't mean it's going to align with what you want anyway.
Yeah, and there are famous stories, which you don't need to necessarily get into, about where people's attempts at controlling it have gone horribly wrong. But I don't think we certainly have a great understanding of what necessarily determines someone's gender and gender identity and attraction and orientation and so forth, which, is actually fine. I think let's spend that effort in trying to be inclusive of it rather than trying to figure out why and to control it, because a lot of times the why has an undercurrent of, I think this is bad and I need to know why this happened, right? It's sort of the same way when you hear about a tragic thing, like a plane crash, and you always want to ask yourself, why did that plane crash? Because you're thinking, I'm going to get on a plane someday and I want to know that there's a reason that I can avoid. And so a lot of times the why comes out of fear. And I don't know that it matters in this case.
Yeah. I think being responsible for another life, I understand, is terrifying. I guess that's something that we don't really talk about, is being prepared for what does unconditional love mean? I think the implication is that you're going to have a kid and you're just going to have it. And I don't think that's the case. I think it's something that you have to actively think on and work on. And it's as much self-work as it is external work of knowing what unconditional love is. Like, how many people truly have examples of unconditional love in their life from another person?
It is, I think, also a big challenge of someone you care for, who you are responsible for, of finding the balance between, I want things to be good for you, but I also need to respect that this is your life and not mine. And it's kind of yours to deal with it. It's not like I'm going to buy you a present and then call you every day to tell you what to do with it, right? I mean, It's not the same thing, but it kind of is. It's like, it's not yours anymore once the person's alive.
Yeah, my mother does not understand that.
I think it's a hard thing. It's a hard thing. Sometimes people get stuck in this idea of optimizing futures for their loved ones, for their children, that gets in the way of them being unconditional. Especially if things are not optimal, but if you require that things be optimal for love, it is clearly not unconditional love.
Right.
Yeah.
Talk to me a little bit about gender affirming care, what that means and how it shows up in people.
Oh boy, that's complicated because there's not a great answer, single pat answer to that.
Because it's a construct.
Because it is a construct, and it is sort of what pieces are important to a specific individual. And I think the most important thing that I try to convey when talking to providers about this is you need to figure out, oftentimes with the person you're treating, what their goals are, what things you can provide that help them align their gender identity with the things that you are trying to help them with, and then go from there. And that a lot of times, especially non-mental healthcare providers, can get focused on the very physical things. Are we talking hormones? Are we talking about surgery? What are we talking about? And it isn't necessarily any of that. It is, so gender affirming therapies in general is, what can we do so that this sort of incongruence you have between your gender identity and other aspects, like your imposed gender, your physiology, your anatomy, all that. How do we get that so that those come together, so that they're more aligned, so that you are living a better life? Traditionally, that has relied heavily on a diagnosis of gender dysphoria, the idea that essentially your gender identity mismatching the other things creates enough stress, you are dysphoric, you're unhappy. And that's a lot of places still use that as a way of saying this is the medical reason why we need to do this, as a way of kind of making it more acceptable, rather than just, I'm just trying to address the incongruence. You don't have to have dysphoria. You don't have to be miserable. But how do we get it so that these things that we can affect are helping you sort of live your life as the person you internally know yourself to be? And I say no with the idea that a lot of times people's understanding of themselves and their gender identity and so forth will evolve over time. And so it can actually be a moving target, which can be frustrating to the providers. It can be frustrating to the individual person you're trying to help. But that's just gender and stuff. That's all complex, and you just kind of have to go with it. There are, for example, pretty well established protocols for, let's start with hormone therapy, because that's what a lot of times people think of when they think of gender affirming therapies, masculinizing or feminizing hormone therapy, right? There are particular protocols, right? So, for example, if you're trying to give someone hormones to help with feminization, it's usually a combination of giving them an estrogen and trying to stop the body's own production of androgen or expression of androgens, or both, which great, right? That's kind of what we know, because we have this idea that, okay, someone who we know as being a classic physiologic cis female, like we kind of know what those hormone levels typically run, but not always. And we kind of know what those testosterone levels normally run. So we're just going to try to do what we can to get to that. It's a little bit more complicated when someone is non-binary, when someone is gender non-conforming, because what that looks like, and I mean what that looks like, literally what that looks like, but also how you get to that point, where that person needs to see their internal self and their external self and their place in the world and so forth, can be murkier and actually varies a lot from person to person. So it's really important to have a discussion of how do you view yourself and what do we need to get you there? And so, for example, a lot of times people will have come to us with questions of, this person identifies as non-binary. What am I supposed to do with their hormones? And the answer is, you kind of figure it out together. And one of the really important things is to look at aspects like how, if they are doing therapies that do affect their body physically in some way, which, is not necessarily the goal for everyone, and that's important to remember, is to think about what am I going to use to monitor my progress? How happy are you? How well aligned is this? How are you feeling about your physical changes? It is not just, I need to draw your estrogen level and see what that is, which is tough when you talk to a lot of doctors who just love things like numbers and data and labs, and no, actually just talking about their goals is part of it. And so, I say this about hormones, this is going to apply to anything, talking through with a provider about their gender identity. It can be surgery, it can be speech therapy, it can be the use of prosthetics in your clothes, all of that stuff. I mean, there's much, much more, but that general principle of figure out your goals and how you're going to get there is the sort of core, as I view it, of what it means to provide any kind of gender affirming therapy.
Yeah, I think it's interesting that you say even doctors like having numbers and equations, and I feel like that goes for so many people. We just want to have a rule, a way to do a thing. I don't know if it's a math formula, but even if you get into like complex math, formulas kind of go out, and it's much more up for debate on what correct math is. I am not a math expert by any means. I know that it gets much less, 2 + 2 = 4.
Sure.
Like, it becomes less concrete as you dig into numbers and what they mean and what they represent and how you represent concepts as numbers. I think my point being that even in, like, I'm a professional video editor, people want to know How long does a shot need to be? How long does an edit need to be? If you're an artist, how dark does a line need to be good? What is good? What's the right way to do it? And everyone just wants an easy answer. I think we're all craving an easy answer so that we can navigate life correctly. And I think the more we learn about anything, the more we realize like we just cannot have simple answers for anything.
Well, sure. I mean, though, gender related care is not a differential equation, right? You can't solve it, even if it's more complex than 2 + 2. You can't solve it. You sort of have to figure it out. And I think one of the things there are a lot of things that drive that need for something that is, quote, objective to wrap your brain around. And some of it is to try to ensure that you're doing it right. Some of it is sort of fear of the unknown, especially in people who, as practitioners, have not done this very much. And so that can really drive the need. And some of it is tough because a lot of the expected effects that you're hoping to have may not happen or may not happen for a while. So, for example, it's really, really tough to get rid of body hair just by blocking testosterone with the medication we have. And so one of the ways you can sort of think about it is, well, I just need to check the testosterone level. Maybe I'm just not blocking it enough, or maybe this is just not happening fast enough. And I think in that sort of uncertainty, you can sort of rely on that as a crutch to know, like, what am I supposed to be doing? And I get that. And I get that, if I'm thinking that being generous about the provider's motivation, it's just like, I want to make sure I'm doing a good job. But also I can imagine that from a patient perspective, also a lot of times it's like, I've been waiting my whole life to do this. I want to do it right. And I kind of want to do it now. And there can be a bit of frustration with that. And sometimes, it's just so exciting to do that it can be tough waiting. Well, let's just wait for 3 months and see what your levels are like. And so I get that, but gender is not anymore a number in your lab work than it was when I started with my definitions of it. And so to rely on what are your hormone levels, or what is, how have things been hooked up after your surgery, or any of that stuff, that is not what defines it. It's a part of it. And so it's important to think of how expansive our concept of things like gender are, to use that expansive concept to figure out, how are we doing with that, and are we getting there?
Talk to me a little bit about some of the phrases or arguments you hear from people that bother you the most as a medical professional.
Oh, sure. And this may actually sort of get into some of the stuff that you had asked about. There are a lot of things that bother me. I think some of the terminology that's very old, like transvestite, absolutely bothers me. And it sort of depends on your definition of transvestism, which classically is described as a paraphilia, which is like not a paraphilia being a particular sort of in its classic definition, abnormal sexual interest and so forth. That's not what this is. Or cross-dressing and so forth. A lot of that has to do with being obsessed with aspects of gender expression and not really what is going on underneath. And those are stigmatizing words, right? So being called a transvestite is, outside of Rocky Horror Picture Show, or arguably within Rocky Horror Picture Show, pretty negative. And I want to say that a lot of times it's because people had learned those terms. So, for example, when they were learning whatever DSM version they were learning, they learned that term, the DSM being the Diagnostic and Statistical Manual, which is how mental health diagnoses are made for those of you listening. I think people, maybe just those are the terms they knew, so they applied it, but I do think a lot of people have been resistant to learning new terms because of their negative attitudes towards folks. Similarly, the term hermaphrodite often comes up, and hermaphrodite, and you had a previous episode talking about a Salmation identity, which incidentally come from the same Greek myth of Salmacis and Hermaphroditus sort of becoming merged into one body. So this is technically the term hermaphrodite hermaphrodite or hermaphroditism in medical language is having the sex organs typically associated with both sexes. This includes gonads. It's incredibly uncommon to have someone who is born a, quote, true hermaphrodite. And I said this in medical school, they use the term true and false hermaphrodites, the false ones being someone who had some differences of sexual differentiation, sort of like the androgen insensitivity we sort of talked about before. But true technically would require that you have both sets of sexual reproductive organs, including testes and ovaries, which is tough because they come from the same tissue. Mm-hmm. So, for example, it's very, very uncommon for reasons that we won't get into for someone to have a testicle and an ovary. However, so a lot of times when we think about those terms, it has to do with the external genitalia. So the idea that someone's a hermaphrodite is, again, usually medically incorrect and a dismissive term. Do not love that. So, for example, someone who identifies as Salmation, oftentimes, but this is not necessarily true for everyone, that has to do with having external genitalia that you would classically associate with a typical male or female presentation. So, for example, having both a penis and a vagina.
Got it.
Does not typically include anything specific, and this is going to vary from person to person, but generally it's not going to be testes and ovaries because the overwhelming number of people will have one or the other.
Sure.
But so, for example, though, you can have a vaginoplasty. So that is creation of a vagina in someone who does not have one, but for example, has a penis, by using some of the tissue, including some of the scrotal tissue, which, may not necessarily, generally does not necessarily keep the testes, but you can create a vagina and then have a penis on top of it. Or you can do a phalloplasty where you keep the vagina, but then number of different techniques can essentially either create a penis or do things to try to have the clitoris function more like a penis. And then there's sort of stuff in between. So, for example, there's a metoidioplasty, which involves cutting a ligament that supports the clitoris so that it actually falls down and it falls down further instead of being sort of held up. So it actually sort of protrudes a bit more. And then that plus the use of testosterone will make it grow more. And so, for example, someone who might identify as a trans male or someone who wants to undergo masculinizing changes, right? They don't necessarily need to be trying to get a scrotum and a penis and get prosthetic testes or something, for example. They can still have a vagina and then something else on top of it. So that is oftentimes that gets confused with this object or the idea of being a hermaphrodite. But a lot of times it just means having sexual organs, and by bisexual I mean sex, not that you necessarily have to use them for the act of sex, because you can do all of this and be asexual, for example, and that's still okay. It's more as an expression of your gender and trying to get your body to match that. The other thing that sort of bugs me is just refusal to use people's pronouns and names. It just bugs me, or the need to constantly point out, well, this is and we don't use these terms anymore, but this male to female and female to male is like needing to just sort of keep pointing that out is not necessarily particularly constructive. Knowing. One of the subjects that sometimes comes up is if, let's say, someone does identify as a, say, trans woman, is it important to know that they were assigned male at birth? The answer is kind of depends. If it is important to know that because of their surgical, anatomic, medication history, sure. Do I need to know it if I'm treating their diabetes or their ankle? No. And then one of the questions that comes up is, do you need to have that as part of their medical record? If they identify, if their gender identity is just woman, do you need to have that asterisk trans woman in front of it? And that can get a little bit thorny, because then you're trying to have a discussion of, am I asking this because I'm trying to understand their identity and how it relates to them? Or am I trying to use this as a medical marker? Or is this honestly stigmatizing, right? I would say if you feel like, no, it's just something that I need to know about them, then you should be saying things like, this is a cis woman, but you don't. And anytime we use labels for some people and not others, it's implying that we think that there is a normal default. And the only reason we do have to say something that's not that normal default is when someone falls outside of it, and therefore they're not normal. And so honestly, that's actually probably the thing that bothers me the most, because I think that is the thing I see most frequently. And it is just one of those 1,000 cuts things that erodes people's relationship with healthcare providers.
I'm not someone like I've never had any kind of surgery done. So what is the response to these surgeries? Are they, I don't know. I don't even know like a language like on terms of intensive, or I don't know how big a deal in terms of recovery and impact on your health do these surgeries have?
Well, it sort of depends on the surgery. Some, hopefully it has an impact because that's why you're doing it.
Right.
In terms of things like how complicated it is and your recovery and so forth is, I mean, it sort of depends on what you have done. And generally speaking, oftentimes people will break down the surgeries into top surgery and bottom surgery. That's not entirely right, because there's a lot that can happen. The top surgery usually referring to things that are happening in the chest, usually with the breasts, and then the bottom surgery being things to do with the pelvis, including the internal and external genitalia and sexual organs. But, there's obviously other things that people have done. People will have things done like facial surgery and removal of hair and changes to things like their vocal cords and the laryngeal cartilage, also known as the Adam's apple, and so forth. So they can sort of deal with all that. Essentially, everything outside of the pelvis oftentimes is less big deal surgery than things that involve the pelvis. And it's essentially the things that involve the pelvis, abdomen, and inside your chest. So basically anything that kind of has to do with your torso, just generally surgically speaking, is a little bit bigger of a deal. And there's more to do before and after the surgery. So, for example, someone who has vaginoplasty, so creation of a vagina, there's a pretty important routine of using dilators to try to keep the tissues from getting closing up and tightening and so forth. And so it's not like, well, it's done, I can forget about it. And so that's one of the things that's also really important, is to have conversations with people, which, any good gender affirming surgery place will do, is what can you expect, what can't you expect, and really be thoughtful about this, because most of the non-surgical stuff you have a little bit of flexibility with. Once the surgery is done, if some stuff gets removed, then if that's not where you need it to be, it's a little bit harder than to say, well, we'll tweak your dose of your hormones. Is a little bit easier to do. And so it's important to just be thoughtful about your goals with it and what you can accomplish with that. One of the things that is, at least thankfully, has changed over the last decade or two is that being able to have access to surgeries, they're still incredibly expensive, and they're because they're surgery, and their availability on insurance plans is fairly variable. But prior to that, this was out-of-pocket expenses for people who could. How are you supposed to pay tens of thousands of dollars for a surgery out of your pocket? And drove a lot of people to seek care, for example, outside the U.S. because it was cheaper elsewhere and so forth. So I think one of the nicer things is that we have more places doing it, more places paying for it, so we can actually ensure that people are getting care and that they're getting good care and they're getting care close to home, so that when they are recovering from the surgery, they have people around them who will help them, which was not always the case and placed this horrible burden on people.
Yeah, I think surgery in general is kind of like a scary concept to me, just because I've never really had anything done. I think it says a lot to just, for me to imagine getting to a point where I'm like, no, this is something that I want to have done because it's important to me and it's going to make me feel like a complete person. But like being aware of the challenges and things that people go through in order to try and feel that
sure
thing that most people just straight people just feel every day when they wake up.
Yeah, if you don't have to think about it. It's there are a lot of surgery centers still require something to show that you have gone through and thought about it. Letters of support from medical providers. Oftentimes they'll want one from a mental health and a non-mental health providers to say that this is appropriate, makes sense, and this person's a good surgical candidate. Some surgeons will ask for some period of hormone therapy beforehand. It used to be that was a requirement some 20 odd years ago. It's no longer a requirement in general for a lot of places, but sometimes it's, for example, easier to do breast augmentation if you have a little bit of breast tissue to work with. And so having been on estrogen for a while makes that a little bit easier. And so, but a lot of times there are steps to make sure that this has been thought through, right? It is not the surgeon's job to explore your gender identity and figure that out. The idea is if you're coming to the surgeon, you've hopefully been working with someone who is capable and trained and has helped you start answer those questions.
Are these procedures generally safe, like everything we've talked about?
Yeah, I mean, there's one of the nicer things also is that because of the availability and the acceptance of it, you get people who are trained and know what they're doing, and so it's gotten a lot better. And so people will now have specific training and fellowships in providing this care in the same way that you would have a training to repair an aneurysm, right? And so that, I think, helps make it a lot more accessible and honestly safer than it used to be when you were just hoping to find someone who you could afford.
What advice would you give to someone who's looking into getting something done, like any kind of gender-affirming procedure or care?
From my standpoint, having a conversation with somebody about really kind of wrapping your head around what your gender identity is and what your goals are, that's what needs to happen first. Because like I said, this can be complicated, and it's really complicated, especially if you've lived your life kind of being pressured one way, and then you're finally coming to the realization this isn't me, and I need to do something about it. I think that's a hard thing for anyone to deal with. And so having someone who knows what they're doing can help you, guide you through it, is really helpful. We typically encourage having a discussion with anyone. We, in our particular facility, we rely on our mental health folks, mainly because we know that they're trained, but it doesn't have to be mental health. But have a conversation about your gender identity and your goals for care, and whether those goals sort of make sense and what can happen, and whether they're reasonable, whether you're at a point in your life where you're ready for that should happen. That's what we try to do. And I recognize that having it go through mental health can be stigmatizing, and because the idea is there's something wrong with your mental health, and you need to see a psychologist for this thing, which is not how you should be intended. And there's also the concept of gatekeeping, right? So you have to go through these hoops, especially, in places that still require a diagnosis of gender dysphoria as the medical necessity for the treatment. And I can see how that can be frustrating, that you have to have someone label there being something wrong with you to get that. So if we sort of step back from having to pigeonhole it specifically in the world of mental health, but just rather having a provider, ideally the provider with whom you're going to have a relationship and is going to be helping you through this process, having a conversation about you and your gender identity and what your goals are for treatment, and where sort of you are in life to do that. I think that's a great place to start. Beyond that, any sort of further thinking or advice comes from where you want to go with that. And I think one of the important things I try to explain to our healthcare providers is, do not assume you know what people want. It's important to work through and navigate what their needs are and help them figure that out and work it out together.
Yeah, that mentality, even in what I do, bothers me so much. The people don't know what they want. You have to tell them what they want. I disagree with that wholeheartedly. In all aspects of life, I think you need to listen to people, and you need to learn how to hear what they want and not tried to be the smartest person in the room all the time.
Yeah. And like I said, it can be, gender is fluid, and thus gender identity is fluid, and thus gender expression can be fluid, and thus how we get to that expression can be fluid. And that can be hard to accept. This is something that you may sort of have to figure out as you go. Like, how big do my breasts need to be? I don't know. We'll figure it out. We'll see where we are. We'll check in and so forth.
Yeah. My favorite phrase that I think of very often is, how long is the string? And it's as long as it needs to be is the answer to that. So
Okay.
it's something a teacher told me one time.
Okay.
And it stuck with me. I'm like, oh, it's just this concept that there's not always a right answer to this ambiguous question. It's just, it is what it needs to be.
You'll figure it out. You just want to make sure that you're doing right by everyone.
Yeah.
Along the process.
That was so much, I think, great information. It helped me
Okay. So
put some terms and language to things that I don't talk about very often. I enjoy listening to people about their experiences. I haven't really talked about it much because it's not something I've personally gone through.
Yep.
But I appreciate talking about it and being able to just try to vocalize it and put words behind questions that I have. So I appreciate you hanging in there with me as I stumbled through it.
And I appreciate you asking. I like I said before, don't presume that I am right about everything, but I'm just trying to present an opinion of someone who spends a fair amount of time at work thinking about this. So,
yeah, I mean, I think they're questions and things that a lot of people have, but they don't necessarily seek out the information to be informed. I think if it's convenient, you'll get bits and pieces of it in, a social media video or something. But my goal with this is just to put it out there. And if people are listening to the podcast, well, here it is. It's right here. It's convenient. We just did an episode. You learn about you've met all these people throughout the series. Now here's just an episode dedicated to some medical advice for anyone.
wow, this podcast should not constitute medical advice for anybody.
No.
I'm going to make that disclaimer now.
Not medical advice, but context for people who had questions, and just appreciate understanding another person's lived experience a little bit better.
And you can certainly, ask a different provider. They may have a very different take on it. So that's okay, because this is complicated and nuanced and many faceted.
So this is a board game podcast. I feel like we have to talk about board games.
Should we talk about a board game?
A little bit.
Okay.
Have you played anything recently that you're really jazzed about? You have a lot. You've played a lot of games.
We have. I would say one of my favorite games of last year was a game called Voidfall, which is a space 4X game that you can play solo and cooperative. And you just say space plus 4X and I'm already there. And then you add in the words solo and cooperative. Because a lot of my gaming in the past few years has actually skewed playing solo. And I love it because it's crunchy and it's spacey and it's got a bunch of variability to the setup. Balanced variable setup is one of my favorite things, because it means that every time I play a game, I'm looking at a different puzzle. And so the fun thing is, how am I going to do the things I want given what I'm starting out with, or given what my options are, knowing that that's going to be different from last time. And I absolutely love that. The downside is that it takes a long time to play, and you really have to play a tutorial to wrap your brain around it, because it is very crunchy, unforgiving Euro engine building mechanics. It is not the pew pew, I'm going to fire lasers. In fact, the combat is completely deterministic. Going into the combat who's going to win and by how much. And so you really kind of need to know what you're doing. And so all I really do is just keep teaching people the game with the hope that at some point someone will actually play it with me a second time. It has not happened yet. But boy, do I know that tutorial well by now. The other thing I've actually done, I don't know if we're going to count this as a board game necessarily, but a while ago, someone had suggested Blood on the Clocktower to me, which, for those of you who don't know, it is a werewolf style game. There are some hidden roles, and those people are murdering someone every night. And then during the day, people have to choose to execute someone during the day. Someone had suggested that to me, and because I have a couple of friends who really love social deduction games, and I've done it a bunch of times now. I've always run it. I've always run it as a storyteller. I'm an absolutely terrible liar. I'm horrible at bluffing. I get all weird and red in the face and so forth, but I absolutely love running that game because you get to actually, I mean, it's sort of like GMing the game. You have a lot of control over what happens and what information people get and so forth. And really the fun part about it, apart from being the person who theoretically knows the rules the best so people can ask you things, which also just like teaching people games. Part of the fun is your whole point is to try to make the game fun and balanced. And if you can get the game down to the wire so that there's not an easy victory, that you know you're doing well. And that's oftentimes how it goes. And it's, I think, one of the great things about that game is how long people talk about it afterwards. One of the great things, you know, how much people have enjoyed a game based on how much they are processing it and talking about afterwards. And I don't mean complaining. I mean actually like, oh, and then remember when that happens. And people, so it's actually become a tradition now that I go to these events with these friends and I just run a game of it, and it's kind of become a thing, and they will talk about it for a couple of days after. So I've enjoyed that play. I don't ever actually want to play as a participant in it because I think I would be horrible, and I just don't like lying.
Interesting.
Yeah.
No, I'm learning. I'm like weirdly good at deduction games. I'm not good at a lot of games.
Yeah.
I'm very good at deduction games. I just bought Dinosaur Tea Party.
Oh, uh-huh.
Highly recommend. It's a super basic. It's basically Guess Who for 3 to 5 people.
Okay.
And we did it, and we all talked in British accents and little character voices for asking each other questions. And I played my D&D group, so we got into it, and it was a ton of fun.
Yeah.
But I won very quickly because they're just like books to me. These my friends. Just like,
Your friends are books too?
they're just like, oh, I can read you so well.
Well, then I will only play Blood on the Clocktower with you if I'm the storyteller.
Fair enough. I've heard, I feel like several guests have mentioned that game, and I've yet to play it.
It's, well, I can do that for you. Another game that I've actually just sort of rediscovered after about 8 years is the Arkham Horror card game. I sort of shuttered it a while because, you know, the person with whom I played moved away. And then one of the game stores in town took over. Fantasy Flight Games used to have an event every year called Arkham Nights, and they stopped doing that this past year. So one of the other game stores who I know because they run my videos, my YouTube videos in their store, was doing an event. And I thought, you know what? I'm going to rebuild my deck and do it. And I've appreciated that. Went back to appreciating that game. And I think it's really one of the things that can make the game be very narrative without having a lot of overhead is the nature of a card game. There's not a lot of overhead because the rules are just basically the same, and any deviation to the rules or narrative is on the card. And really, in other systems, you don't have a thing where the rules are actually on your playing pieces. And so they can, when you play the cards and the card says, no, actually you do this, you say, okay. And it's not a big deal because you're looking at that piece of information on the thing that requires the information at the time you need it. And so I think it's been fun because it's allowed for them to try a bunch of clever things without me ever feeling like, oh God, I don't remember how to play this game.
Oh yeah, that's cool. And that's the expandable card game, right?
It is, yeah. It's their living card game.
Living,
so
yeah.
yes, so fixed sets, and then you buy a set, and it runs you typically through 6 scenarios, which make an entire campaign. And they've been good about having things that are having different things that you won't necessarily see. So the one we're playing right now is their new one from this year because they're still making them. Is the Feast at Hemlock Vale. And they say at the beginning, you're not going to get through everything, with a sort of nudge to say, you know what, you should probably then replay this and then try to make some different choices, which would be great if I consistently had people to play it with, but I'm still enjoying it. So yeah, those are my big ones.
The struggle is real.
Yeah. So it also works great as a solo game, though. Really, only that was the 3 that I mentioned. Obviously, I was very nervous the first time I did Blood on the Clocktower because I generally, when I try to play a game and certainly teach a game, I like to at least learn it and probably play it solo, which obviously you cannot do in a social deduction game, which is another reason why I tend to shy away from them.
I believe in you. I think you could do it. You could film yourself and then
And the different roles.
have different iPads set up at the chairs.
There are lots of games that I have soloed that otherwise would not seem soloable. But this is coming from the kid who came home from school and would just play chess by himself.
I could see that.
And it did not always end up in a stalemate somehow.
I could see that. I could see that for you.
That is me continuing the echoes of my habits decades later.
So what are you seeing now? And we're kind of jumping back into medical talk for a brief thing before we sign off. What are you seeing right now that's giving you hope for the future? I usually ask about board games, but in this case, what are you seeing that's giving you hope about your profession and inclusivity in terms of what you do every day?
I love that these concepts of gender and gender identity and sex are topics that a lot of our trainees have seen before and that they have conversations about it. I love that they come in with this concept of, what do you mean? Of course you tell people your pronouns when you introduce yourself. One of my students, after watching my lecture where I gave a lot of the definitions, said that she thought that was just so basic, and why was I going into such basic details? And I loved, and I explained why, for the same reason I said to you, we want to make sure we're all on the same playing field. But I love that it was really basic to her, that she had this idea of like, everyone knows this. And I think that when we get hopefully to a point that these concepts are just sort of taught like everything else, it'll allow us the space and the time to have the more complex conversations rather than just being stuck in the, what do you mean they're not happy with their gender? Like, I don't want that to sort of be at the edge of someone's thinking. So I love that these concepts are becoming just part of the discourse nowadays. I am encouraged to see how many people from successively younger generations are taking on gender and orientation and attraction identities that are not the classic standard ones. And that suggests to me that they are seeing it, and enough that hopefully or some of them are living in a space where they can actually more openly acknowledge it than someone, say, could 30 or even 10 years ago. So that makes me happy. And I think that will, once that sort of becomes normalized, it will help us provide just better care.
Yeah, I think it just goes to show that representation matters. I've said it hopefully every episode, but it makes a difference for people, even if you're not part of the LGBTQIA plus community, to have that language and exposure. It benefits everyone and harms no one, in my opinion.
Yes, you don't lose your identity by giving someone else theirs. It might make you lose a little bit of privilege, and I'm okay with that. I'm actually okay with you losing a lot of privilege.
Yeah, there's plenty.
Yes.
Still plenty.
Exactly.
Well, that was amazing. That was everything I wanted it to be, and then more.
I love it when someone tells me that.
There you go. It's recorded.
It's recorded.
It's for proof.
It's always a pleasure talking to you. Thank you.
All right. As a disclaimer at the end here, I just want to remind everyone that we are just a couple of queer folks. We do not speak for the entire LGBTQIA plus community, nor are we trying to. The best way to be an ally is just to keep listening, learning, and remember, we're trying to figure it out together. That's all I have. If you're listening, know that you're loved and perfect just the way you are. And until next time, bye.
Bye. Cue outro music.